Good afternoon, everyone. This is County Executive Pat Ryan. I hope you are staying warm and dry on this kind of cold, dark day. But I hope everyone also had a nice weekend. And for those that did have a holiday yesterday, hope you had a nice holiday. We had a really good, we were just chatting, a good pumpkin picking session with Theo. So to see a 14-month-old discovering pumpkins for the first time and trying to eat a big pumpkin, that's definitely a lot of fun. So anyhow, shifting into more serious matters, we're going to talk about the COVID situation and also briefly about some of our mental health need and services and an event we had today. But it should be a relatively quick update, and then we'll get everybody on with their day. So by the numbers right now with COVID-19, you can see we are at a total since the beginning of the pandemic of 2,378 total cases, and we've now tested well over 100,000 residents, 105,000 plus, and fortunately the vast majority have recovered, 2118. And at this point, thankfully, we are continuing to hold at 95 total fatalities since the beginning of the pandemic. Unfortunately, some news to share today, though, is we are seeing what I would say is very much a concerning rise in hospitalizations. Since our last update, which was 4 or 5 days ago, the number of hospitalized residents in the county has doubled. We are now at 10, and at our last update on Thursday, we were at 5. So that's something that obviously, as I said, is concerning and that we are watching very carefully. You can see that trend, although the numbers are low, you can see it on the graph there, where really for the first time in months, we've crossed that threshold of rolling average over 5 and trending up. And so this is, again, a reminder that COVID is serious and can be deadly, and that we cannot let our guard down as we continue to drive forward. And to those, our neighbors and friends and family that are right now in the hospital and dealing with this, we send our love and our positive energy for a quick recovery for everybody. Total active cases in the county, we're still around the same level, hovering at 165. This is slowly creeping up from a few weeks ago when we were down just over 100. Generally, this has stayed about the same, as you can see on the graph, but another metric that we'll be watching carefully as well as we continue to head into fall and colder weather, and folks just continuing to have to deal with the things we're asking, and we know that gets more and more difficult by the day. The metric we continue to primarily focus on is the new cases and the number of new cases each day. This is still looking pretty good. We did have a small increase about 10 days ago where we were over 1%, but now we are back under 1%. Over the 96-hour period, we have had 27 new positives, and that's out of 3,126 tested. So again, under 30 new positives out of over 3,000 tested. That puts us at a 0.86% new infection rate over a 96-hour period. In the last 24 hours, we have had a closer to 2%. We've had 10 new cases out of just over 500 tested. But we really try to look at a multi-day average just to kind of control for the small fluctuations. And so with that 96-hour average, we are under 1%. So one of the things we're trying to look at and that our team is looking at is, even though the total number of cases and new infections have stayed about steady, to see the hospitalization number go up so significantly is something that we're watching and trying to understand what is driving that. The numbers are relatively small, so we don't want to overread, but to see that number of hospitalizations double in a 5-6 day period is obviously not what we want to see. And again, we'll continue to watch that. In terms of hospital usage and capacity going forward, as I said, 10 residents currently hospitalized. Unfortunately, 2 of them in ICU beds on ventilators. That's also a relatively high number compared to what we have had for the last few months. We do have more than adequate need, of course, going forward, and hopefully don't need to use that. As we zoom out and put these numbers in context, I think we are seeing the intersection of a few key things happening. One, the weather is getting colder. 2, we've had holidays and fall period and lots of travel and interaction and different events, including some religious holidays. 3, more and more people are coming back to school, and most of our school districts in the county now have some form of hybrid education happening. So many of those risk variables are increasing, and if we're not very, very careful and really vigilant and disciplined at the individual level and the organizational level, then that's where we see things potentially spiral out of control. We're definitely not at that point now, but we've seen this happen in several neighborhoods in New York City and even some of our counties to the south in Rockland and Orange, where the science and the health experts' predictions are true, that if we don't follow the precautions, this virus does what a virus does, which is spread rapidly, and we could easily be back in a situation where that is happening. Our goal as a collective team, as a government and as a community, really has to be, we will have some small pockets that pop up. That's essentially inevitable. The goal and the imperative is that we quickly detect those and contain them, and make sure that we don't get to a point like we were in March and April and May of community spread, meaning it's gone from a small cluster that's concentrated and somewhat controlled to a widespread community level transmission and infection. So that's really our goal, and the plan that we have, our rapid response plan heading into the fall and the winter, is designed really to do that. And we've been able to do that successfully as a community and as a county because everyone has done what we've asked and followed these guidelines and precautions. And the 3 most important are and continue to be wearing masks, maintaining social distancing, and washing hands and using hand sanitizer. Again, it's getting old, and it's difficult and sometimes frustrating, but we've just heard over and over and over that masks in particular are the single most effective way to slow and control the spread. So please continue to do that. I know everybody tuning in is doing that, and the vast majority of our community is. So let's keep that going, and thank you to those who have. One other quick update that I just wanted to share before we wrap up. I just earlier today came from a really powerful and impactful event, a rally and speak out event related to our behavioral health services here in Ulster County. And you've heard me talk about this before. You've heard me get upset and frustrated, and I hope that you've seen the op-ed I wrote about a month ago calling out as unacceptable the recent decision by Health Alliance to permanently move and remove 60 behavioral health beds in Ulster County, right at a time when we're seeing the need for these services double or more. We've seen opioid overdoses increase over 90%. We've seen suicides tragically double in the last 6 months in the county. And right in that moment, to have our supposed healthcare partner pull these services out right from under us and really turn their back on the most vulnerable members of our community at a time of need, it's just unacceptable. And so I was very proud to stand with our nurses and healthcare workers, with other local leaders and community leaders and activists, all of us standing there in the rain, in the cold, raising our voices to make clear that we are not going to allow this to happen, period. And that the only way that that works in our great democratic system is if we all raise our voices and we all are willing to tell others about this, that this is happening, to mobilize around this, to post on social media, to make phone calls, to write letters, to show up when we do more of these rallies. And make sure that something like this isn't brushed under the rug or forgotten in the midst of a lot of challenges and many crises. But it's moments like this where we see that need as so great and so urgent, with so many struggling with mental health and substance use issues. This is the moment that we have to look back on and say, you know what, this almost happened, but the community rallied. We all stood and we said, we're not going to allow this to happen, and crisis was averted. I'm confident that we can do that if we take this seriously and if we act with urgency and as a collective. So the same way that we've rallied through COVID and rallied to get food to each other and emergency housing and so many other things, we have to do that again. And so I'm asking for your help and your engagement and your participation on that. We'll keep sharing updates as to how you can do that. But for now, the best way to do that is letters or emails or calls or social posts to both the hospital, to Westchester Medical Health Alliance, as well as to your local elected leaders. Although I will say we had everybody from the mayor of Kingston to myself to our assembly person and state senator all aligned and all on the same page on this. But let's keep it that way, and that only works if you all are engaged. So thanks to everyone that showed up to that event. I especially want to thank the New York State Nurses Association that organized the event, to 1199 healthcare workers that spoke, to hear the stories from healthcare workers who are, as one of them described it, we are often the only people there as healthcare workers for individuals struggling with mental health crises and addiction crises. And I just want to thank them for being there and raising their voice as well. On that note, I want to thank everyone who's tuned in. I want to thank all of our frontline workers. Today, of course, on this topic, we'll specifically shout out our nurses, doctors, medical professionals, all the staff that makes the hospital run, from the aides to janitorial staff, everyone that's put their lives and their families' lives at risk, especially during COVID, to take care of us. We thank you, and to all of our other frontline workers, thank you. And thank you in advance for your continued work. We think about those 10 individuals that are in the hospital right now receiving top care, and at least we can feel a little bit better that we know they're getting great care from our healthcare workers. So on that note, thank you to everyone for tuning in. Please continue to do the right things and keep us safe and healthy as a community. If you or anyone you know has needs, whether it is for mental health services, addiction services, food, shelter, especially as it's getting colder, please don't hesitate to reach out. Our Recovery Service Center, that's what we're here for. That's what our great team is here for, to be there for you during these tough times. You can call at 845-443-8888. You can also email or go to our website, which is up on the screen. Until our next update, which will be Thursday at 2 p.m., I hope everyone stays safe and healthy and continue to be resilient and take care of each other. And we will see you soon.